So I want you to sit on this thought for a second. I just read an article that said 50% of people in the hospital having a heart attack have normal cholesterol levels. Not because their cholesterol is healthy, but because they're medicating, using statins, their cholesterol's down to the normal ranges, which is what the doctors say should prevent you from having a heart attack, yet 50%, 1 out of every 2 heart attack physically happening in the hospital, they have normal cholesterol levels. So what this should tell you is that lowering your cholesterol numbers is absolutely meaningless when it comes to fixing or preventing cardiovascular disease. And the real question we should be asking is if our doctors have been barking down our throats all these years, lower your cholesterol, lower your numbers, LDL's under 100, right? Total cholesterol under 200. All of this is an absolute fat lie. What they're not telling you is the real cause of cardiovascular disease, the blockage, the attack, the issue, is an inflammatory metabolic condition known as cardiometabolic disease. And you can have that even if your cholesterol numbers are normal. And here's the crazy part. You could be taking statins, making your cholesterols perfect, and still have cardiometabolic disease. So what is this thing called cardiometabolic disease? Well, number one, it's insulin resistance. Elevated insulin is known to cause inflammatory responses in the vessels of your heart. Number two, homocystinemia. It's a fancy word. You know what it means? High levels of homocysteine, because your MTHFR gene is either deficient or broken and you can't get rid of homocysteine, which is a cardiac toxin. Number three, ferritinosis, again, another fancy term. High levels of ferritin, oxidized iron. It's a sticky protein. It gets stuck in your vessels. It causes inflammation. And what it does is it rips the vessel open. You start to microbleed. Now watch, the brilliance of your God-created human body, the cholesterol comes around to plug that hole, to sort of seal the damage. And then we blame that as being the cause of cardiovascular disease. So stupidly insane. So if you want to have better cardiovascular health, number one, check your insulin levels, get them as low as possible, 5 or less. Number two, check your homocysteine levels. They should be under 6. See, a lot of medical doctors will say 9, 10, you're fine. No, 6 or less. Check your ferritin levels. If you're a man, it should be under 150, and if you're a female, it should be less than 100. It's this simple. Find out where they are, figure out the underlying root cause, work with a functional physician, get rid of the metabolic condition, the inflammation comes down, and watch this, guys, the plaque can actually get out of your arteries. I've seen tons of patients have 50, 60, 70% blocked arteries go through our functional program, doing magnesium EDTA chelation, anti-inflammatory diets, homocysteine, ferritin detoxing, and guess what? Clear. I even have a patient who came back from his cardiologist and was told, I have a new diagnosis. And I was like, what is it? He goes, non-obstructive coronary artery disease. Non-obstructive, meaning his artery is now wide open and clear, and yet they said he still has heart disease because you can't get rid of heart disease even if your vessels are open. So even the cardiologist is like, we don't know what to do with you. So look, if you want more information about how to do this, make sure you show up to the very event you registered for, my functional medicine approach to solving cardiovascular disease. I'll show you how to do all of that and more when you show up.